Good morning and welcome to our webinar with Dr. Grace. I am Sarah Harker, your host for today and the Business Development Manager at Freedom Healthworks. And I am so excited to be joined by Dr. Grace. Welcome.
Hello, Sarah. How are you?
I'm doing well. I am recovering from a weekend long of baseball and football fields. So this feels a little bit like a resort today.
Well, that's good. You know what? Enjoy that because that time will go by so quickly. I miss that, believe it or not.
Yeah,
There's a point where you actually get to the point where you say, I miss those days, but you
I
find
believe.
some new things to fill in those gaps. So
Yeah, I believe that. This is a really fun phase and it's
yeah.
fun watching them, but holy smokes, do I have new appreciation for my parents.
You didn't realize how smart your folks are until you have
Um,
your own kids.
exactly.
And
That's what my grandpa always says that he went to college and then he realized that his parents were getting smarter. And so I
so
totally,
true, so true.
which is
But
kind of a good segue for our conversation today and
uh-huh.
looking for people who have gone before you. We didn't even plan that. That worked out pretty
I
well.
know that's good. That's good. You're on it this morning.
Yeah, so our whole conversation is going to be very interactive. Please feel free to jump in the comments, ask questions. We promise not to laugh at you, or at least not for very long. And please feel free to ask as many questions as you'd like from either Dr. Grace or myself. And between the two of us, we're pretty darn resourceful. So if we don't have the answer, we can find it for you. But we're very excited to talk to you about how you don't need a business degree to get started. So let's just take a collective sigh of relief for that one. No more school. You've already gone to enough school. I think that you will learn quite a bit from this. So grab a pen and paper. And again, feel free to hop in the comments. We understand that some people are already in a non-compete and have some personal things in the background. It's totally fine to ask anonymously. It's not our goal to out you. So feel free to do that as well.
And there's no question that is dumb. You've heard that before, okay? The best way to learn is to learn from mistakes. And actually, a lot of what you'll hear us talk about are the mistakes that were made along the way, and that's why we're better for it. And we've learned from that. And so, please go into all of this with open mind and just ready to absorb as much as you can. And hopefully, we can give what you need out here.
Yeah, perfect. Why don't you introduce yourself, Dr. Grace? I mean, we were just talking about all the hats that we wear, and you have so many. Author is one of them besides doctor.
That's a new one for me. But first, I'm a wife and mother. I have two children, both in college now. I have been a podiatrist. I specialize in foot and ankle pathologies. I've been practicing on the Gulf Coast of Florida since 2001 in a private practice. I went to Vanderbilt for undergrad. I went to medical school at the New York College of Podiatric Medicine and did my podiatric medicine and surgery residency at St. Vincent's in Jacksonville. I am recently an author. It came about from me helping other doctors transition into what we're going to be talking to about today, independent private practice, outside of the insurance-based and third-party payer system. I love what I do now. There was a point in 2013 that I was ready to give up everything. I am a second-generation physician. I have a general surgeon father and an internal medicine clinical cardiology mom, who are both happily retired now, who I'm sandwich generation because I take care of them. But Sarah and I were talking about how we realize as parents now how smart our parents were. They practice though medicine the way it should be. You were one-on-one with your patient. It was always based on the relationship you made with them. And despite the fact that they were practicing what I call the heyday of medicine because it was before all the managed care things. I was free labor in their office, so I learned and garnered a lot of my instinct from them by just working in their office whether it's forced labor or not, I don't know, but it's
I
one of
remember
those
those
things that
days.
you learn from everything that you get exposed to. So I am the product of all my surroundings. I have a wonderful husband who actually is a, a, a in the health insurance side, who was the one, he's a benefits guy that convinced the doctor to get out of insurance because he could see the writing on the wall. And so he's been the most supportive of this from day one. And one pearl, if I can start with these, make sure, number one, that you're happy with yourself and what you're doing and know where you're going and what you want. So
Mm,
know what you want, remember your why, and don't be afraid to ask for help. Those three, if you start this whole conversation today with those in mind, I think it'll be easier to guide yourself through it.
yeah. I love that. And that's easier said than done.
Oh, I know.
Especially, I think when we spoke a little bit about residents earlier today, and I think when you're coming out and the world is your oyster, you've got all these options, knowing what you want can be so hard, and you have so many people telling you what you want.
Exactly,
It
exactly.
takes time.
One of the
Mm,
things I also tell residents a lot of times, and this is something I learned from a mentor of mine before, in residency, there's a lot that you're going to learn. We have the best training in the States. There's a lot that you're going to learn during your residency, but just as much as what you learn from the people that you're being taught by, there's a lot of things that you'll learn not to do also. So pick up both the good and the bad, because you know what to avoid as time goes on. So this is where the mistakes come into play that you'll learn from them.
Yeah. Oh, that's so good. I think, if you've heard Chris Habig very well, our founder and CEO, and he talks a lot about watching those mistakes ahead. And when he originally started wanting to go pre-med and then thought, I'm going to go another route. Once he learned as well from his parents that are physicians. And then I don't think I told you this, but my dad is an optometrist, so I can totally relate to those. I got roped into inventory more than one time before I was age appropriate, I think.
I think there's something good about, I was not the traditional student also in going into medicine. A lot of it had to do with cultural push towards medicine. I actually worked in Washington, D.C. for a good 5 years before going back to go into medicine. So if any of you are finishing up, if any of you are in finishing up residency and feel like you need a break, take it. Take
Mm,
it. Be smart about it, make sure financially that you can handle that, but take it, because there's something good about perspective outside of what we've been so engrossed around for years and years. And so for me to take the break between undergrad and med school, I think was important. I wouldn't have met my husband, but it also gave me an opportunity to work outside. And so many things of what we talk about in physician entrepreneurship, running a small business, a small private practice, it is something not unique to medicine. It's something that you learn from all different businesses. And if you don't know how to react and respond and talk to other businesses, there's so many things that you can learn from there. One thing that I use in my office when I'm note taking is a POS system. And for those of you who worked summer jobs in restaurants, you know what I'm talking about. A POS system is when you're able to just click on a button and it will propagate a whatever you're buying, but in my case, whatever service I'm offering, and my receipt's made for the patient already. So, there are little tricks like that that you won't learn in med school because that's not what you're there to learn, but you learn from life. So.
yeah. Talk to us a little bit about that. How did you jump into this and learn through it at the beginning? What were those resources? How did you find your way?
So when you were getting out of school, the question was always, or getting out of residency rather, what are you going to do? And there's a huge shift in what residents are graduating into. When I was finishing up almost 25 years ago, back then, the norm was to grow into a private practice or a single specialty group or a multi-specialty group, but there was not a push to work for a hospital. Ironically, even our residency programs were actually partially exposed to private practices. That has not been the case in the last 10, 15 years. Because as I roundtable with residents, a lot of times what I'm hearing now is like, oh, I've been approached by such and such a healthcare healthcare organization or a hospital. I'm going to work for them. There was a recent study done by Merritt Hawkins, and someone else bought their company, but they do like the survey for the last year residents. And you're talking about over 100 encounters with one individual by multiple entities, healthcare organizations, and hospitals. Of course, if you're being dangled all that job right in front of you, you're going to kind of lean towards that. But when I was going out, what happened was I thought it can't be that difficult to start a new practice. And originally I was going to go solo, but I ended up joining a single same specialty practice. And I took advantage of being able to learn from someone that was already in practice. It's mentorship, basically. You watch how they run their practice, what practice management software they were using. We weren't using EMR yet. We were still paper charts. So many things have changed. One of the things that we were talking about off air, the resources that were around when I was getting out versus right now are night and day. And one of the things that your organization does, Freedom Healthworks does, is really help with handholding the new doctors out there. There's a lot that you can do. It's almost like being a toddler and watching them begin to walk or getting on a bike and removing the training wheels.
Right.
There are some that can just immediately jump on, and there's some that need training wheels and hand holding. And again, don't be afraid to ask for that. But for those of you who aren't aware of it, Freedom Healthworks has a wonderful program where they can help you through all the non-clinical things. The clinical things, that's an assumption. You should know that because you've been taking enough schooling and training and also testing for that. But the integration of that with business savvy, you have it in you to learn this. You are able to learn all this. And if you approach going into private practice or running your practice like taking care of a patient, piece of cake, because you know how to do that already. There's so much parallel in what we do as physicians on a day-to-day with a patient that if you just take your private practice and start analyzing it the same way, it becomes very easy. The idea that you need a business degree, no, you don't need a business degree. I have a business degree, but I got it after I'd been in practice already. To be honest with you, I think that's a better way anyway to get a business degree, because you can then use what you learn in business school to enhance what you're doing in your practice. And so I don't know if I answered your question. Did I answer the question?
Yes, you did.
Okay.
No, you totally did. And I think I was just thinking it's almost like a residency for business school. It's like, you're being an intern going through your own business with that. And I think there's so much value. I always say you can do anything. I mean, if you get through med school and you get through residency, of course you can start a business. There's so many great resources out there. One of my favorite things about direct care is the collaboration.
Right.
Just like you and Freedom, we didn't work together, and we're more than happy to collaborate and help people find whatever resources we can out there, whether they work with either of us or even if they don't read your book, God forbid, read Dr.
Well, thank you.
But, I think that's the general spirit of direct care. There's always one person out there who's tooting their own horn and not going to help, but, that's everywhere. The majority of direct care is very collaborative, ready to help you, start asking questions. They were there too at one time. And we just are so passionate about seeing this movement go and getting patients the care they deserve and keeping doctors healthy and giving you the mental health that you deserve. So I love that you said it that way of just jump in and then go after if you want to. I think that's really interesting.
You know, it's one of those things that there are two ways to get ahead. And you either, everybody starts here, you either push somebody down, so you're higher,
Mm.
or everybody raises up. And, you know, you always hear the old phrase, the cream rises to the top. And that's what the direct care movement seems to be. It's win-win for everybody. There's nobody that suffers when we do well in direct care. From the physician's perspective and from the patient's perspective, who ultimately is your why you went into medicine, because you're helping that individual. And so there's so many things about it that just it's so, you know, it inspires you to just keep doing it. And
Yeah.
so yeah, there's no harm also for those that are seasoned to rethink what you're doing. Are you happy with where you're at right now? You know, one thing that I remember what it was like starting out when I left the group. I was in that single specialty group when I left that group and had to open up on my own. So now I had tools, having worked in somebody else's office. I knew what worked over there and what I didn't like and what I'd like. And I took that and I brought it into my practice. And then I started one by one. The first couple of days, you're not going to be seeing multiple patients all the time. You know, you build it one day at a time, one patient at a time, one relationship at a time. One thing that is a huge mindset change from insurance-based medicine, which is what you're exposed to in residency and those that are seasoned have been exposed to in their practices. There's this idea more is better.
Mm.
That you have to see more in order to learn more, in order to do more, in order to make more.
Mm.
What'll happen is you'll tire yourself out. And that's what happened to me in 2013, because as changes occurred, reimbursements went down, you had to see more patients, and you were not doing what you wanted. You weren't following your why of taking care of your patient, and you were seeing more patients in the same amount of time, but you're not doing good to them or yourself because you can't get a full history on them or anything like that. That's having more is not better there, you know. By getting out of that scenario, you're working smarter, not harder. And I think that is a concept that is not pushed a lot in medicine. Maybe now it's beginning to change a little bit, but there's so much that we have to learn in medicine. So you have to get you're geared towards that. That probably was a huge mindset shift that you have to take. But with Freedom Healthworks now available, so many resources online. I'm going to plug my book, The Private Practice Solution. And as I mentioned to you, that the thing to do when you're taking on your private practice on your own is to treat your practice like a patient, analyze it like a patient. The book, the way I wrote it, is actually like a SOAP note. So if everybody's familiar with our SOAP note.
Everybody knows that.
Yeah. And so, you know, you take the subjective component of it, understanding what you want, what's the problem, you go through the objective findings and look at your data. This is where accounting, you know, the idea that you can't do accounting. If you can read labs and analyze that and then synthesize from it, if you can make a prognosis, you are doing finance, you know, there's a lot of correlation with what we know how to do in a person that you can do in your practice. And just go through the SOAP note, subjective, objective. Your assessment is when you realize, I want this to be the result of my practice and direct care practice. And then your treatment plan is you follow on with that, you know, trying to give patient retention, patient acquisition, pricing yourself, marketing yourself. And those things may sound scary. It's not. You're doing that every day. Every time you have to convince a patient of your protocol that you want them to follow is marketing. You know,
Yeah.
you have
Let's
to
talk
think
a
of
little bit
it.
about that marketing,
What
because
about marketing?
I think this is really interesting, whether you work with someone or do it on your own. One thing that is a commonality that you have to do is be part of the community. And I think you do such an outstanding job of that. I think one
Thank
thing
you.
that's kind of funny that we hear, especially from introverted docs, is that they don't really want to get out there. But the funny thing is, when you're passionate about something, it's amazing how much you can overcome that. You know, we're not asking you to get out there and talk about your whole life story. It's just
Right.
the difference in how you're providing care. And I think we see people overcome that quite a bit. But talk to me a little bit about that community and how you built that practice.
So the community is based on where you live, who you interact with, and really, again, getting back to relationship, a lot of the community building that I did was in my office. So
Mm,
early on in my early part of changing and transitioning to direct care, I talked to my patients. You have a captive audience in
mm,
front of you right there. And your goal is not to convince everyone. Your goal is to just express yourself of what you want, what you have to offer. And
mm.
from that point, leave it up to the patient to decide where they want to go.
Yes.
Another mindset shift, work harder, not work smarter, not harder. A mindset shift. It's always the patient's choice. It's choice. You know, all you can do is put yourself out there. The
Mm,
patient ultimately has to make that choice. And so it is, you may feel like it's vulnerable because you don't have control over it, but
mm.
you do, because what you put out there will come back. Work with your community. We were talking about our kids. Um, I can't tell you how many times I sponsored baseball teams and football teams and basketball teams, or just went out and talked to parents. I mean, it's not anything above and beyond what you're doing. You're just talking to them about things that you're dealing with on a day-to-day anyway. So that becomes easy. Church or any community groups that you're in, get involved with that. And then for me, I'll use an example that I still use today. Because it's not a one and done. You are constantly relating with your community, because particularly if you're not in primary care. As a specialist, my care is what we call episodic. I have some patients that come in regularly, a lot of my diabetics, my patients that have really bad arthritis, and but there's a lot that's also just episodic, just trauma related, surgery related. So you're constantly wanting to stay active in that community. It's good for you. It's good for the soul. But it's also good for your practice. And one thing that I do is I partner with my like shoe stores in town
Mhm.
and meet
I
the
love that.
employees, meet the employees and talk to them about what to look for in shoes. A lot of them, the funny thing is, a lot of time they'll ask you like, how do you deal with the toenails? Or how do you deal with all the calluses? I mean, it's funny conversations, but but what I want to also tell them is like, this is how you watch them walk. This is how you watch them. And I go, don't do anything that you feel uncomfortable. The best thing to do then is send them my way. Let them get a professional opinion on something that might be bothering you. It's not your job as the salesperson
Mhm.
to diagnose them, or tell them what's going on, but you can be beneficial to them, even if they don't buy from you. Ultimately, they want the sales folks want to buy from them, but ultimately, you're guiding them. We're just here to help. And so you guide them to where they need to go. And that's what we're doing in medicine too. We're guiding our patients to get themselves better.
Yeah, I mean, that's so brilliant too on so many levels, talking to the shoe store person, because also not only are they in front of your ideal client every day, and even
Mhm,
if you're not a specialist, there's other people who are still your niche when you're in direct care, who you're
mhm.
aiming for. Think through that and try and find who that shoe salesperson is for you. Also, anytime they meet someone in their personal life that they hear having a foot problem, that's going to
Right,
pop back into their mind.
right,
And
right.
remember that. And then also you're going to be sending them clients with that, I'm assuming, not to buy high heels and to buy, some solid shoes, which
There are good. There's some good high heels out there. You just have to know
oh
how to fix
good.
them
That's
up, and again, it's patient and customer choice.
there you
That's what
go.
it comes down to. To a certain extent, high heels also in my line of work is job security. So,
Yeah, that's a
no,
good
but
way to look at
it doesn't matter what specialty, even with a surgeon, they can be talking about GI upsets and
Yeah.
food and nutrition and other
Sure.
things like that, or just safety mechanisms at a trampoline park, or just yeah, there's a reason why people come to you. All right. Find out what are some of the more retail reasons why people come to you. So
That's great advice. That's worth just coming to this webinar just for that piece of advice. I can't agree with that anymore. And I think one thing that's kind of interesting, you know, you don't have to be so strategic about it. I mean, that happens to be a really great strategy, but just meeting somebody new in your community, you might make a friend. It doesn't
right,
have to be
right.
that intense, right? And you might be thinking, I'm 30 something years old. I don't need new friends, but that's not true either. We know that. So getting involved in your community, having an excuse to go out and meet somebody, and something can come of that. So I think kind of taking that pressure off and remembering not everything is med school, not everything is residency or traditional medicine of trying to meet all these standards. You still have a life and you're still a human.
Right. And even within your own specialty, you don't have to be as niche as what I was talking about. To be honest with you, I didn't do a lot of the shoe sales thing, all the early on. I actually did that later on. Like you said, it's just getting with your community and just getting out there talking, whether you're at a cocktail party or a birthday party for your kids, it's just meeting people and telling them what you do, and then remembering other people in your town that you're basically, you're connecting, you're a connector. That's what it comes down to. But the getting back to private practice here, the resources, what we're doing here is connecting.
Mhm.
The resources that are out there. I would look also for direct care. We have so many associations now with direct care. I'm gonna throw some out there. The Free Market Medical Association is one of the bigger ones because it brings buyers and sellers of healthcare together. And it's all based on having price transparent, making sure that people understand the value of what is available with that, and it's equality because you're able to do it with no barriers whatsoever. There is typically a chapter within your area or your state. Go to the website and check that out. I would also look at the Direct Primary Care Alliance, the Direct Specialty Care Alliance. In my book, I actually have a resource page that goes through it. And we'll talk about, it talks about how to contact them there. If you're on social media, oh my goodness, social media, that just in itself has really changed a lot of the discussion here. I'm old enough to remember when that was not the case, because I remember when it was still dial-up and AOL. So I had one of the first accounts on that. So, that's it's a huge change
Yeah.
with things. And so don't, to say that it's not out there, you're missing it. I don't know what someone's missing it if you don't realize it's there. So
Yeah. That's a great time to plug. We're going to do a giveaway with some
cool.
Freedom Healthworks swag. And then we're also throwing in a copy of Dr. Grace's book. So you can have
And
all
I'll
the
sign
access
it.
to those resources. Oh, a signed copy, even better. So, and if people want to find you, you already mentioned social, you are out there, you are available, and you are at a lot of conferences too. Talk about how people can get in touch with you if they have any more questions. What's the best way to reach you?
So if you have any questions, go to my website. It's Dr. Grace DPM, whether you're coming to me as a physician needing some assistance, or if you're a patient out there and need a foot doctor.
Yeah.
So Dr. Grace DPM, and on there, it'll bring you to my link tree and it will have everything on there. If you're on social media, if you do at Dr. Grace DPM, you can find me on there. I usually will hang out when it comes to this discussion. I usually am hanging out on Twitter, on LinkedIn, and on Instagram. And I do speak at conferences. One thing that I do also at any conference that I've been speaking at with regards to direct care, if there's students there, they get my book for free. So I donate that there because, ultimately what it comes down to, we want to continue, number one, practicing medicine. We want to keep good doctors practicing medicine, and we want to attract good people into medicine. So, ultimately, we all become patients again, in the midst of all this also, not in a bad way, and just to stay healthy. And maybe one more pearl to throw out there. The whole thing about direct care is not an anti-insurance thing. Okay. I think a lot of people have mistaken, and you talk about that at Freedom Healthworks all the time. Healthcare and health insurance are two different things. Healthcare is what those of us in medicine are providing as forms of treatment, services, and procedures to get somebody better. Health insurance is a risk management tool to assist with healthcare expenses. It is a method of paying, but not the only method of paying. You need insurance to protect yourself from things, but there are different types of insurance out there within the healthcare realm to do that. It's not an either or. It's not like be in insurance and not be in insurance. It's both and. What we're trying to do is we're trying to build up what we can control. If you think about what we've been doing in direct care with primary care and specialty care, we're trying to bring patients out into the community and out of the hospital, keeping them healthy, being proactive rather than being reactive, so that those that really do have problems can get to the emergency room, can get into the hospital, can be treated and we're not wasting all the extraneous efforts on routine things. And an analogy that I always use in discussing that, imagine if auto insurance would pay for gas, windshield wipers, and oil changes. And that became, your premiums would rise even more than what it is today. But there's no incentive for the owner of the car to take care of themselves or to take care of the car. Same thing with people. There's no onus for a patient if they think everything's going to be paid for to take care of themselves. And what we're trying to do is remember, there's a responsibility there. There's personal responsibility and accountability there. And those of us in direct care really believe in that for our patients and for ourselves also. So
yeah, that's a great analogy. I like that.
There, that's a freebie today.
Thank you. I appreciate that. Well, I'm just keeping an eye on our time. We like to keep these nice and short and full of good info for you guys. I'm really thankful for the time that you spent with us, Dr. Grace. You're a wealth of knowledge, and we are planning on talking you into coming back and talking with us again very soon. So brace yourself for that. But thank you so much for sharing those resources, for sharing a copy of your book, and we look forward to that next convo.
Sounds great. Everyone out there, keep doing what you're doing. You've got this. Don't be scared. Just take the time for yourself.
And not to be too corny with the podiatry part here, but take the next best step, right?
That's a good one.
Take the next best step. That's it. If we can leave you with any piece of knowledge today, it's take that next step. Reach out for that resource, whether it's reaching out to Freedom, reading the book, reaching out to somebody on Instagram. We're here for you. We're rooting for you. And look forward to those conversations. Make sure that you drop your email address below so we can do our giveaway. We know that you're here, and hopefully you will be the recipient of a really fun box.
Sounds great.
All right. Thank you, everybody. Have a great day.